Jon Berti of the New York Yankees suffered a non-contact leg injury Friday night against the San Diego Padres. At the time of the injury, the absolute fear was that he was dealing with a full-on Achilles rupture. It looks like today the Yankees have released the imaging results of Berti's case, saying that he, as of right now, is diagnosed with a calf strain and is currently on the IL for 10 days. With today's video, we are going to go over the specific anatomy of the calf musculature. We're going to talk about key anatomical structures, as well as the grading system for these calf strains so that we can predict an athlete's return to sport. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with this channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I also go over the relevant anatomy for that injury and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with a calf strain, go ahead and comment in the comment section below. So we see here that Berti's going to hit a grounder, and as he's going to run out of the box, he's going to push off of that left foot, and right after that is when he's going to fall to the ground. So here I have a model of the foot and ankle, and for the purpose of this video, we're going to focus more so on the back portion here because that is where the calf muscles are located. So you have three main calf muscles, the first one being the gastrocnemius. That is the big muscle that we often associate with as being the calf muscle that's going to originate actually up and it's going to cross the knee joint and attach onto the femur bone. Then it's going to come down and it's going to form into that Achilles tendon, which is going to attach on the calcaneus bone. Because the gastrocnemius is going to actually cross the knee joint and attach onto the femur here, it has two main actions. The first one is that it's going to facilitate in flexion or bending of the knee. And because it's going to come down and attach onto that Achilles tendon, it's also going to be involved in a main motion known as plantar flexion, where the foot is going to be pointed down like this. Then we have another muscle known as the soleus muscle. This muscle is located a little bit deeper to the gastrocnemius. However, in this case, it's not going to cross the knee joint, but it will come down and also form onto that Achilles tendon. And its main action is going to be involved in plantar flexion, just like the gastrocnemius. However, because it does not cross the knee, it's not going to be involved in knee flexion. And finally, the last muscle in the calf is known as the plantaris muscle. This muscle is actually going to cross the knee joint just like the gastrocnemius, so it's going to play some role in knee flexion. And because it's coming down and attaching onto the Achilles tendon like the other two muscles, it will also play a role in plantar flexion. When we're talking about calf strains in general, the most common muscle that is strained in these types of situations is the gastrocnemius because it is so large and it's going to span both joints. Now, there is a chance that the soleus could be involved in this injury as well. However, it is important to say that when we see calf strains, most likely it's going to be that big gastrocnemius muscle. Most often when these calf strains occur, this is going to be whenever the foot and ankle are essentially in a position where you're going to be stretching that gastrocnemius muscle. And that's what we see in this case. We see that as Berti is going to plant and push off, he's allowing that foot and ankle to go through a motion known as dorsiflexion, which is going to stretch that gastrocnemius muscle and put it at risk for a potential strain. If the force is great enough in this position, then this can also, of course, lead to a full thickness Achilles tear, which is what people feared initially when they saw the injury. And we've seen this commonly in the past with other sorts of athletes that have these non-contact Achilles tears in this similar position. There is an on the field or in the clinic test we can do to essentially rule in an Achilles tear, and this is known as the Thompson test. So what we're going to do is we're going to have the person lie flat where they're going to be prone, and what we're going to do here is we're going to squeeze that calf musculature. And when we do this in somebody that has an intact Achilles tendon, that foot is going to plantar flex like so. If we do this and we don't notice any motion at the foot, then this makes us believe that the person has suffered an Achilles rupture. You can also palpate and kind of come down into that Achilles area. Sometimes you will see or feel a drop off where the tendon should be. But of course, the gold standard to diagnose these types of things is going to be the MRI. Fortunately, in Berti's case, the imaging results have been released saying that he's dealing with a calf strain, and that's going to bring us into the grading system. The grades of calf strains are grades grades 1, 2, and 3. In a grade 1, this is where you're getting some stretching of the affected muscle. In grade 2, this is where you're getting more of partial tearing of the affected muscle. And finally, in a grade 3, this is where you're getting a full rupture of the affected muscle. Now let's talk about time frame. So in a grade 1, you're going to be out anywhere from about 1 to a couple weeks. It really depends on the severity of the strain and how that person is presenting. In a grade 2, they can miss anywhere from several weeks to about 2 months. It really depends, once again, on the severity and how they're presenting. And finally, in a grade 3, because you're getting a full rupture, this is obviously going to be the absolute worst case scenario. And a lot of times this is going to require surgical intervention, so the person is going to miss significant time. The Yankees have not officially released the grade of Berti's injury. However, based on the time frame, given the fact that it has been 10 days on the injured list, it sounds like he's dealing with more of a grade 1 calf strain. Anytime we get somebody in the clinic for these acute calf strains, essentially what we're going to do in the initial stages, because they're going to have a lot of inflammation, is we want to make that person as comfortable as possible. So we're going to apply ice to the area, we're going to wrap the affected area, and finally, if the person really needs it, we're going to elevate it above the person's heart to essentially help with the swelling. Then as the person starts to feel better and we see that the person is healing and walking better, that's when we can start to work in specific movements in order to increase their range of motion. And finally, when the person is appropriate, we can start to work on strengthening. Calf strains are quite painful, even if it is a grade 1, because it's a major motion of the leg that's being affected for walking and running. So essentially what we need to do is we need to be a little careful initially so that we don't make matters worse. Given the fact that they've given him 10 days and the fact that he avoided a major Achilles rupture, makes me think that he's going to make a full recovery. If I happen to hear anything regarding his case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Berti the best of luck moving forward. Thank you so much for tuning into my video today. If you enjoy this sort of content, I'm going to link one of my playlists so that you can look at some of the injuries that I've talked about in the past. Thanks once again for tuning in, and I'll see you next time.